My name is Barbara Voltelen, and I'm a Danish senior lecturer at the nursing program in Vejle, in University College Lillebaelt, it's called. I'm here to talk about we have just launched the opportunity for the students to get an optional course in family nursing, because in Denmark we don't have that much history of using family nursing in practice. We are very individual oriented, and normally if you ask a Danish nurse if she talks with the family, she will of course say, "Oh yes, I do," but they don't get included. They are there and they are allowed to be there, but in another way than you actually tend to do in family nursing. I'm myself also a health visitor, so I've been, in all my professional life, I've been thinking about families, working with families. So in my option, it's natural to do that, but it's not in our education. And in the ministerial order for bachelor students in nursing, it's not explicit that you do family nursing. Families are mentioned, but very, very distant. So we do include some family working, but not that much, and that's what we want to change. So this fall we launched a possibility for the students to choose that they want family nursing, and we made a course lasting for 2 weeks, and it's students that have been studying, have been undergraduate students for 3 years, so it's not that far away from when they have to write their bachelor thesis. And they have already at that time a connection to a certain ward, so they have, in these 2 weeks, they have the possibility to go out in the ward and actually try to see if somebody uses family nursing, and also try to maybe, if it's possible, to see if they can make a genogram, for example, in the clinical setting, or to see if some of the nurses are using circular questioning or whatever. And I think it's very important to connect both clinical practice and then the school. We unfortunately only have about 14 lessons of interaction with the students, and that's where we want to present them for the general theoretical framework behind the Calgary Family Assessment and Intervention Model, narratives and systemic theory and things like that. And upon that we also want the students to practice making genograms, echograms, and also coach them in some sessions where they are divided into groups and they try, with a fictive family story, try to live into this setting and trying to make these circular questioning and seeing the family as a unit, and that everybody's perception is equal important. So I'm looking very much forward to having the opportunity to give the students the insight into family nursing, and I hope very much that it will be an ongoing course that we can provide for the students.